Hello, everyone. Have you ever woken up and you are swollen? Maybe your cheek is swollen and it stems from your tooth. Yeah, that's a dental infection. So, how do you avoid dental infections? I'm Dr. Valerie Mukanga with Healing Wings Dental, the place where we have our patient maintain and or regain their oral health and smile so that they can soar in life. So, yes, a tooth infection, how do you avoid it? Before we go into that, I want to talk to you about how do you even recognize that you have tooth infection. So, number one, is what I talked about initially is that your face is swollen and it's because you have had, a tooth infection. So, depending on where or which kind of tooth is infected, your infection can manifest in many different ways. If it's a lower tooth, oftentimes, if it gets to the point where your face is swollen, it will be more like the bottom part of your of your face that would be swollen. So, your cheek is swollen, but kind of like underneath. Now, if it's an upper tooth infection, then it can affect kind of like around your eye area, sometimes, I mean, close to your eyes. So, more like up here where you would have an infection. And then sometimes, it would be your eye can even, if it's really a big infection, your eye can even be affected where it kind of like closes and things like that. So, that's how you recognize that you have a tooth infection. That's number one, and that's more, recognizable. Another way is if you see that close to a tooth of yours, when you brush your teeth, you see you have like a little pimple, and we call it, a fistula, which is an area where, you have an infection, and there's like a pimple where you have suppuration, or a big term for like pus sometimes comes out, or sometimes blood. That's also indication that you have an infection. Or, if when you press on your gum, you feel like, it's kind of like bouncy, if I can put it that way, that's also something that shows you that you do have, a tooth infection. And oftentimes it comes with pain, but many times it's not painful at all, because at that point, when it's painful, that means that your nerve is angry, like your nerve is still alive and trying to fight this infection. So, like, its anger is like causing pain. But when the nerve that's inside the tooth is actually dead, you will not feel anything. And that's why, many people neglect. Maybe they would have had, pain, and over time, the pain decreases and they have no pain at all. So they think that, the problem has been resolved, but it's not resolved. It's like growing an infection. And then when that infection occurs, you manifest it in different way. And so, as I was saying, sometimes you don't even feel pain, but your tooth is in fact infected. Okay, so that's how you recognize it. So how do you avoid it? How do you avoid it? It's not very difficult to avoid a tooth infection. Really, it stems from just regular oral hygiene. And so when we often let our patients know about oral hygiene, we let them know to really be mindful of two, two, one, and two. So 2 times you want to brush your teeth. You want to brush your teeth in the morning, and you also want to brush your teeth at night before you go to bed, especially at night. I say especially because most people actually think and they know, okay, yeah, I have to brush my teeth, in the morning so my breath can be smelling good, so I can have a fresh breath. But they tend to like ignore, the evening time. So they're so tired, they just fall asleep and they don't brush their teeth before they go to bed. And at night, we have decreased salivary flow. So because you have less saliva, bacteria are going to have an easier time adhering to your teeth, and that, thereby causing or leading to the beginning of cavities, and that evolves, over time. So you definitely want to brush your teeth 2 times a day at least. And then another thing you want to make sure is that you do it for a total of at least 2 minutes. You don't want to just rush in there and you're brushing and then, like 10 seconds, you're done. No, don't want to do that. You want to make sure that you at least brush for 2 minutes. That way you're making sure that you're brushing all the surfaces of every single teeth. And we often tell our patients, the tooth that you want to keep in your mouth, brush that one teeth. If you feel like you don't really care about one tooth, you can avoid that one. That being said, I'm sure you want to keep all your teeth, if you're like me, because, I already lost one tooth and I don't plan on losing any more. And that was when I was a teenager, stemming from the fact that we never really went to see the dentist, right? Okay, the one out of 2212 is that you want to make sure that you at least floss your teeth once a day. And flossing is essential. Why? Because it's going to help you remove debris of food, particles, or bacteria that gets lodged between your teeth. Okay, so you want to make sure that you're scraping the areas between your teeth. The bristles of the toothbrush, I can't stress that enough, are too thick and they cannot go between your teeth. And many times, we see patients and we do our oral exam, clinical exam with our instruments, and there's no cavities. You're looking at it and it's like all the surfaces of the teeth look pretty clean, no cavities, as I said. But when you go to the x-ray, oh my goodness, sometimes it's like, whoa, there are cavities everywhere between the teeth. Sometimes you can't even tell, so you actually have to look at it on the x-ray. Flossing will help you decrease, that from happening. So you want to make sure that you do floss at least once a day. Then the last two, my friends, is that you actually want to go to your dentist at least twice a year. As I said, when I was younger, we did not really have, the habit of going to see a dentist. And so that's how I lost the front tooth. I don't want that to be your story. So 2212, want to make sure you brush 2 times a day at least for 2 minutes. One time you want to floss, and also you want to go and visit your dentist at least twice a year for your routine checkup. So that's how you're going to avoid having tooth infection. Now, how about if you actually are one where your tooth is actually infected? What do you want to do to actually treat that? Well, what you want to do is you definitely want to go and see a dentist. We have had some patients who say, okay, I feel like my tooth is infected. I'm just going to take, something. And some of them do, they would took like some tools and try to remove their teeth on their own. And some of them do and have left, like cracked the tooth and part of the tooth is still in there. Trust me, if the tooth is still there, that infection is not going to go away. Some people go and they go borrow like some antibiotic from one of their friends or family members. They're going to take it, the infection is going to decrease for a little while, and it's going to wake up, it's going to come back. The way of actually taking care of a tooth that's infected is actually either treating the tooth if it's treatable still, or actually having that tooth removed, because it can kind of like play a yo-yo on you where it comes in, you take medication, it goes back, and then it comes back. And I tell you what, teeth have that nasty habit of waking up in the most unpristine time. It's not like there's a good time, but it'll be like at night you're trying to fall asleep and oops, you start having pain, you can't sleep, waking you up at night. Who wants that? I wouldn't. So yeah, make sure that you actually, if you actually went to a dentist, that you do take heed to the recommendation that are given to you, because it's not a matter of us trying to do the most or just trying to make a buck. No, it's because we care about you and we want you to be well taken care of. So make sure that you actually take the action that has been recommended to you, so that you can be better off. And then after that, we can look into the rest of your teeth and making sure that you do not end up getting an infection again. So that's how you want to avoid, okay? Make sure that you follow proper oral hygiene. Don't skip going to the dentist at least twice a day, twice a year, twice a year. And make sure that if you have an infection, find your way to a dentist. Some people go to the hospital. If the hospital does not have a dentist, they will not be able to help you in the right way. So find your way to a good dentist that can actually help you take care of that problem. Okay, that's what I wanted to talk to you about. It's not very difficult for you to avoid tooth infection. You can do it by following those steps we talked about. So if you find this information to be valuable, please Don't forget to like this message, to share it with your friends and family so somebody else can be educated and know what to do if indeed they are having or have been affected by a tooth infection, so that they can know how to recognize it, so that they can know also how to get it treated, so that they can live a better, have a better quality of life. So that was Dr. Valerie Mukanga. If you are in our area, Dallas-Fort Worth area, we are Healing Wings Dental. Again, our phone number is 972-213-0202, and you can call us. We can help you in your oral hygiene, in your oral health, so that you can, like we said, soar in life. That is our vow. And also, if you want to contact us, you can also do it on our website. You can try to get an appointment with us at www.healingwingsdental.com, and we are located at 4101 West Green Oaks Boulevard, suite number 317. Any question, please don't forget to comment below so we can see your question, answer your question. We are here to help you. All right. So as always, you be blessed. Make your day positive. I wish you the very best. Rooting for you in your oral health journey. All right. Take care. Bye, and see you next time.